Evet, İkra.
Başlıyorum.
Hello, dear lecturer. In this presentation, me and my friends talk about Charlize Theron's post-traumatic stress disorder. Then we will talk about diagnosis, etiology, and treatment of PTSD. Charlize Theron was born on August 7th, 1975 in Benoni, South Africa. She started taking ballet lessons at the age of 6, but her ballet life ended due to a knee injury before she turned professional. When she turned 16, she started modeling. Theron was discovered by John Crosby, who happened to be there one day while she was at the bank during an argument with an employee and was going to be her manager in the future. Thus, her visual career, which began with ballet and modeling, continued with acting. Between 2001 and 2011, she was married to Stuart Townsend, an actor. He adopted two sons, Jackson and August. He has starred in many other successful productions, such as Waking Up Reno, Mad Max, Fury Road, North Country, Fast and Furious, Hancock, Sweet November, Devil's Advocate. She also received an Oscar Award for Best Actress for her successful lead role in the film Monster.
Behind the successful career of this world famous beautiful actress is a tragic childhood story. A bad incident that happened when she was living in South Africa at the age of just 15 has already caused a great trauma in his difficult childhood. One day, when her alcoholic father came home after drinking too much again, Charlize threatened Theron's mother with the death by pointing a gun and starting to shoot. Theron's mother took the gun and killed her husband in front of her daughter's eyes to protect herself and her daughter. When this incident, which caused Theron's experienced trauma, was moved to court, her mother was not punished on the ground of self-defense. After this incident, Theron's experiences at a young age were worse than the aforementioned incident. Charlize, who already had problems fitting in when she was little, was more ostracized by her friends after this incident.
After a certain period of time, she preferred to play difficult female characters in her acting career. Although the reason for this is not exactly her own past, she has started that she is reconciling it with what she has experienced internally. Devam edelim. She even starred as the character Ellen Wuornos in the Oscar-winning Monster movie. People like Ellen Wuornos that people just want to label and want to tuck under a rug. Theron said, no one wants to study that person. No one would look at that person and say, but why did this happen? I'm amazed at why. Because in many ways, I'm here because of why it happened today. In addition, Theron was shown how much she embraces the idea, not bothering to gain weight and get ugly while dying for this character. Although she had incompatibility problems after all that she had gone through, she overcome her trauma thanks to the support of her mother and the strength of her career. Having even managed to overcome this trauma, Taryn said, I've been through it and I'm very proud of it. I worked hard for this and I'm not afraid of it. I'm not afraid of the dark. In fact, I'm interested because I think it explains human nature and people better. Despite her past statements, she stated that she preferred to reflect the discourse of her trauma in a good sense, not a bad one, on her life. As a result, Charlize Theron has been a good example of how traumas can be overcome by not being addicted not developing a personality disorder by facing her trauma.
I will continue with that. We write an essay. I will mention about that. I will start with diagnosis of PTSD, Post-traumatic stress disorder is a serious, for everybody strange physical or mental stress rehearsing occasions subsequent to experiencing trauma. It's a psychological disorder with the presence on different levels of autonomic dysphoric and mental manifestations. Dialed back in response to diminished interest in the rest of the world. Expanded actual work, the fundamental condition for the advancement of this disorder is to have encountered a traumatic occasion. Hence, it is as yet questionable today that the determination of post-traumatic stress disorder is an etiological definition, not the same as other mental disorders, and regardless or whether it ought to be taken care of outside DSM framework. Because of the traumatic occasion encountered, the first definition more post-war, war-related, it occurred in the 19th century, when the manifestation thought to have created as Jacob da Costa in the mid-year of 1871 on the irritable heart. Palpitations in troopers battling in the American common conflicts furthermore depicted the fight-stress reaction with the side effects of chest torment. After the present circumstance, it's been known as the fighter heart or Da Costa disorder. Professor Octave Laurent begat the expression "commotio cerebspionel" after the Turco-Bulgarian War in 1914, portrayed an image like the battle stress response. After the side effects that show up in officers interestingly, after the conflict were characterized along these lines, a bunch of indication connected with traumatic occasion has been characterized. Edwards in 1908 in Messina that 25% of the individuals who encountered the seismic tremor had traumatic bad dreams and rest disorders. Such revealed that encounters diminished the obstruction in the focal sensor system and traumatic mental issues happened. In 1914, Hasnard attempted to depict the indication after two boats blast in France in 1907 and 1909, indications after the popular Coconut Grove Dance Club fire in 1941, traumatic experience considering the indications. It was acknowledged as a psychological instability by being associated with the occasion. Abraham Cardinal accumulates the psychological and mental reactions to the traumatic occasion under one conclusion and named these photos psychoneuroses. This definition, he shaped the reason for the biopsychosocial meaning of post-traumatic stress disorder and made the meaning of PTSD extremely near the present DSM rules. The idea of injury, reiteration, passionate bluntness, and hyperarousal, the terms it characterized. Grinker and Spiegel in 1945 studies hypochondriac reactions from ordinary reactions, isolated track. The hypochondriac reaction is more in the inner self showed that it contained regression and distinguished delayed disorders. Other mental reactions to Herandau's injury are concentrated by trust. Canada, 1957 has been made. Assessing the two significant fire calamities, the contact of the casualties was isolated into 4 gatherings. Assessed 12% of casualties had the option of appropriately assess the circumstance, make an arrangement and carry out it, while keeping up their condition of cognizance. 75% can be characterized as a typical response showed limiting in the consideration region. Independent reflex and conduct, 25% gave unsimilar reactions like dysentery, loss of motion, stability, crying or yelling. 1 or 2% insane response illustrated. Because of this multitude of studies and definitions, the side effects experienced after injury are DSM-1, named gross stress reaction and depended on the traumatic responses that happened after the Second World War. It has expressed that there are polite and military subtypes. No constant type of disorder is incorporated. This coherence is the point at which indications don't vanish, not connected to a previous disorder. In 1987, 6 extra manifestations were portrayed in the DSM-3R. These manifestations are psychogenic amnesia, injury-related aversion of contemplations, sensation of injury aversion, sensation of no future, touchiness is outrage in DSM-3R. It was expressed that the traumatic occasion ought to be of various seriousness from conventional occasions experienced by individuals, and the presence of evasion manifestation was accounted with the expansion in examinations on traumatic occasion experienced after some time with the finish of mass conflicts, unique because of the examination of traumatic occasion in various kinds as the meaning of traumatic occasion in DSM-4, changes have occurred. The actual occasion and the injury patient reaction is saved to manifestation in the DSM-3R. Likewise, a psychological limit in traumatic circumstances reaction is accessible. What's more, the meaning of the PTSD in DSM-4 dangerous serious disease. Non-actual attacks, improper sexual encounters, stressors like the demise of guardians in youngsters, characterizing PTSD inside unease disorders is a yet questionable today. Tension manifestations in spite of the fact that there are fundamental manifestations going to be burdensome and dissociative side effects. Change disorders that create because of stress and a few mental conditions are the principal conversation focuses. Otherwise called injury range disorders, horrendous character change because of the encounters. Various meanings of behavioral condition, marginal behavioral condition, meaning of this disorder in a similar gathering raises the discussion.
Etiology, post-traumatic stress disorder, severe injury, serious health problems, unexpected deaths, natural disasters, war, rape, violence, traumatic events such as severe psychological disorder that manifests itself with symptoms that may occur after that will create a specific type of disorder. Acute PTSD, when PTSD lasts less than 3 months, is called chronic PTSD if it lasts longer. Not every PTSD can occur immediately after a trauma. Post-traumatic stress disorder that occurs later is called late onset PTSD. The most basic revealing factor at this point is the stressor. Factors such as upbringing style, predisposition to psychological disorder, lack of social and psychological support, and environment are effective in experiencing trauma or overcoming trauma. According to the DSM-4, situations that cause a feeling of horror and helplessness, such as being on the battlefield, witnessing death, losing a loved one, experiencing rape and harassment, experiencing violence, contracting a serious illness, can set the stage for trauma. Situations such as having a special meaning bitti galiba. For the individual, occurring at unexpected moments, prolonged exposure to a stressor, danger of death, direct witnessing of an event, intensity of feelings of helplessness feeling, of guilt and injury increase the impact of the source of stress, increasing the likelihood that a person will experience trauma. Individual factors are only one of the etiologies of post-traumatic stress disorder. The individual's unique characteristics can strengthen and weaken the source of stress, while directly affecting the likelihood of trauma. Factors such as an individual's age, upbringing, religion, ethnicity, personality, psychological disorders that he has experienced and is still enduring the event, his tendency to psychological disorders, genetic predisposition, social support, and the environment can be considered among the factors that push an individual to experience trauma. Elements such as introversion, inability to express oneself, growing up in a repressive family also make it difficult to overcome post-traumatic stress disorder. After the trauma, the individual has difficulty telling the incident, feels guilty, or may experience greater harm when trying to overcome his or her trauma by suppressing it. It is directly effective in terms of a person's religious values, ethnicity, perspective, and reaction to events before, during, and after trauma. If we look at psychological factors, individual and environmental characteristics directly affect the way an individual thinks and his psychological in connection with other factors. The fact that a person has developed or not developed a defense mechanism against the event in his life before the event, whether he has seen the event or a similar situation before, or whether he has imagined it affects the state of being affected by the event, experiencing trauma, experiencing PTSD, and overcoming trauma and responding to treatments. Events that cause intense bad feelings, such as pain, horror, and fear, can be reviewed because they cannot be easily covered by the mind. An individual may experience a similar trauma again as they face situations similar to their trauma, or they may be psychologically harmed by reinforcing the effect of the trauma. In summary, post-traumatic stress disorder, when looking to the etiology of trauma and post-traumatic stress disorder and PTSD in overcoming live with chronic or acute issues and of an individual's age, genetic predisposition, personal characteristics such as sensitivity of stressors and psychological situations differ from individual to individual. We can say that it's one of the most effective elements of. It's very important to prevent trauma as much as possible and to know the causes as well as the diagnosis and treatment parts at the time of the trauma. Tamam.
In this project, I did research about the treatments of PTSD, and I will talk about it briefly. Post-traumatic stress disorder is a disease that causes problems in many areas that affect a person's life, perception of the world, and even social activities. People who experience a terrifying event, such as a wars, natural disasters, domestic violence, abuse, or rape, experience mental trauma and develop PTSD. Not every person who experiences these events develops PTSD. Every person is affected differently by events. Therefore, it is very important to choose the most appropriate treatment method for the treatment of the diseases. Treatment of PTSD is the most used treatment methods in recent years are EMDR, cognitive behavioral therapy, and pharmacological interventions. Cognitive behavioral therapy includes exposure, which is highly effective for PTSD. Psychological treatments give better results than drug treatments in PTSD. One of the most effective methods, EMDR, the patient has several positive effects, including a reduction in disturbing image clarity and rapid reduction in boredom. There are some stages in EMDR therapy. Interest in EMDR has increased in recent years. Many therapists have received training on EMDR. In addition, there has been an increase in scientific studies on EMDR. In EMDR studies, it has been observed that an effect can be seen even in a single session. Another important treatment method for PTSD is exposure therapy. In this treatment method, the patient is exposed to trauma he has experienced. Close reminding of the event are used. Post-traumatic stress disorder in adults can be largely controlled, but for children, PTSD is more difficult to treat. Psychological disorders such as depression can be added to post-traumatic stress disorder. In such cases, pharmacological interventions are generally used. Patients with PTSD can use antidepressants. It should be used under the supervision of a doctor, as the doses to be used and when the quits are important. In the last decade, the trend towards pharmacological treatment has increased more. Generally, antidepressants and SSRIs are the most prescribed type of medication for the treatment of PTSD. The reason for the frequent use SSRIs is that they have fewer side effects than other drugs. There are quite a 5 side effects in patients with drug therapy. Apart from PTSD symptoms, these side effects wear out the patient. Therefore, it becomes very important to use drugs with side effects in drug treatment. Sleep problems are also common in patients who develop PTSD. Nightmares and insomnia symptoms are treated with medication. Nefazodone and trazodone are among the preferred drug types in this category. Medications are generally preferred for symptom relief. It is not as effective as a psychological intervention. In addition to existing treatments, studies on new treatment methods continue. There is insufficient evidence for currently available treatment modalities. To summarize, because post-traumatic stress disorder affects the whole life negatively, people with these diseases must be treated. An important point to know is that post-traumatic stress disorder is a well-treatable disorder. Thanks for listening for us.
Thanks for listening to us.